So hello, everyone. Good afternoon. My name is Jim Davis. I'm the County Extension Director for Sumter County and Hernando County. And if you don't know where these counties are, we're kind of near Tampa. So if you ever heard of Green Swamp, Dade Battlefield, the Villages, that's Sumter County. And in Hernando County, you have beautiful Chinsegut Wildlife Management Area. And Faith, you know, we have mermaids in Hernando County. So the world-renowned Wiki Wachi. So the home of the mermaids. So come visit us in Hernando. So if you're in my area, come visit us. We're going to start our guided hikes here pretty soon, pending UF permission. And so I'm looking forward to getting that started. So hopefully I can see y'all in person. And today, as usual, for our Tuesday classes, we have Dr. Faith Oy. Faith, would you like to introduce yourself?
Hi, everybody. I'm Faith, and I'm one of the urban entomologists at the University of Florida. So normally we deal with the cockroaches and ants and termites and the like structural pests. But today we're going to talk about one that's a little bit different. And Jim, can I go ahead and kick it off here?
You kick it off. We're all good to go.
All righty. So I have given this talk under a couple of different names, itches, illusions, and phobias, also known as sometimes as the Delusory Parasitosis talk. I want to first emphasize that there are people who do suffer from unexplained itching, and their suffering is real. And so the intent of today's presentation is to really kind of help us understand the role of an entomologist in delusory parasitosis cases, and also how we can figure out if we are really suffering from an insect or arthropod borne cause, or an abiotic factor, or if there's something else going on. But I'm going to talk about here the role of the entomologist in delusory parasitosis, and I've put the actual title from the publication up to kind of show you that we've been dealing with this for a long time. So this publication came out in 1962, and we've known about this condition for very much longer. So we have to treat people who are suffering from unknown causes of itching with compassion, because their suffering is real. But if in the absence of an arthropod, we just can't say that it's a bug. So we're going to be sharing some cases as well, but the case studies are not to necessarily to go, oh my gosh, it's really to talk about and emphasize how the pattern of delusory parasitosis hasn't changed either. The term was coined in about 1955. We might have had a little bit earlier references, but this is the first publication date that I could find. And what Maximilian Obermeyer defined delusory parasitosis as was an unshakable belief that live organisms such as mites or insects are present in or on the skin. And in this publication, and again, I'm showing you from the actual publication, because this is not, you know, we're not making it up from the entomologist side. What is not changed is that almost every entomologist is going to run into this at some point. And there is somebody who's going to confront the entomologist with pieces of paper or other material that allegedly enclosed insect specimens. And if you tell them that, I'm sorry, I can't help you, this is a negative entomological finding, it only serves to spur these individuals on to collect more specimens, and then they show up in your office with them. Let's see. So I'm sorry, I'm flipping back and forth here. So what has not changed is the discussion with the complaint. It usually includes the following: that these bugs can change color. And Jim and some of my other county faculty friends may confirm this. They not only change color, we've had instances where people sound like they're describing something that could definitely be arthropod, and then we'll get another short add-on like, oh, and there's sparks coming out of them. And that's a clue to us that we're probably not dealing with something that's an insect. The bugs often jump, right? So somebody might come to us and say, well, I think I think I've been bit by bed bugs. And then they'll go on and do a description of things that are jumping. Well, bed bugs don't jump. And there are other things that we know that this is the physiology of what they're trying to describe is just not credible or attributable to an insect.
And that's one of the most common, I think, as far as extension faculty go, what we get, the bugs jump. And so, you know, we've seen people, I've been to people's houses where, you know, they're pointing at the bed, Faith.
Yeah.
And they're pointing at the bed and they're like, see it jump right there. And I'm looking at it, there's nothing there. And it's jumped again and it jumped again. So that's something that we see as extension faculty quite common.
Right. And so there are a few more points that we have here. So the bugs are infesting my hair. They can shake things out. They'll bring you like paper towels or plastic bags full of things that are clearly coming from, you know, it's hair or scabs or dandruff and whatnot, but it's not really insect. They'll show you bites or irritations that are caused by itching. And I'm going to show you some pretty serious damage, skin damage at the end of this presentation here. And here's where we start to kind of, it gets to be a little bit concerning to us when we hear that the bugs are coming out of household items like toothpaste, Vaseline, cosmetics. I've had people say that they're coming out of light bulbs, and Jim, I don't know what else you've had.
We've had just about all of that.
Yeah.
You know, coming out of mattresses, coming out of, you know, BJ actually wrote in the chat box,
Plastic
so they attack people in plastic bags and other inanimate objects.
Right. So this is a serious one here, also has not changed. People think that their home is so infested that they actually move to another location, and then these bugs appear in their new dwelling. So my first job out of graduate school was at that other orange and blue school north of us. And I remember the county extension director for the county extension director called me, and this is in the battle days when cell reception was not good. And there was no such thing as Google Maps. So I was coming back from like a 5-day tour with the Pest Control Association to do training for them. And he said, you need to meet me off of I-85 at this sign. He was literally standing. I could see him as I was driving up I-85, and he was waving me down to take this next exit. That's how we used to navigate back then, because this was not even on the road. And this woman was absolutely convinced that she had bugs crawling all over her, clearly a case of Delusory Parasitosis. She had burned her clothes that morning and was in her car moving to a different place because she was convinced that the bugs were infesting her house. And by the time I had finished my program that morning down in southern Alabama and making my way back up to Auburn, her family had gotten a hold of her and committed her because it had gotten to an unmanageable state. So I think that all of my county faculty friends have had similar types of stories there. The patient may be so positive of his infestation and gives such lucid description that his family will stoutly support the contention even if they're not afflicted. So if you're dealing with something like bed bugs, generally more than one person is going to get bit, right? If there's only one person who's suffering, sometimes even the family can be persuaded, right, that there is definitely something in the house. So, but they're not going to have evidence of bites on them. It's just going to be that one person. So that becomes concerning. So Jim, I don't know if you have anything to add here before we jump on to the next slide here.
No, I say go ahead.
Okay. So this is, again, and we emphasize this over and over again, at this point, it's important to note that these people are dead earnest and the problem is very real. So we need to be understanding and helpful and very professional. So the second part of the presentation, I really want to go through with you the categories of itching. So we have explicit organisms, obscure organisms, illusions of parasitosis, and then we're going to talk a little bit about the delusions of parasitosis. So I'm going to go pretty quickly through the first three, and then we're going to spend the rest of our time on the fourth. So we have an overview here about the problems being organic in nature, how to handle this biting pest problem, and concluding comments on delusory parasitosis here. Just a couple of vocabulary words here to help us get through the presentation. This urticate, idiopathic urticaria, pruritus, and fomite. So urticaria is going to be like chronic hives. Idiopathic urticaria is when the rash is unknown. And if we have time later on in the presentation, I'll tell you a funny story about that. Pruritus is itching, and fomite is any object or substance capable of carrying an infectious organism. So in the medical community, they use that term fomite for infectious organism. On the pest control side or urban pest management side, we hear fomite transmission in relation to head lice, which is a very rare event. So category one, insects can be readily found like fleas, right? We know that fleas can bite us and our companion animals and cause itching. Fire ants and ticks as well. Other things that can cause itching would be mosquitoes, bed bugs. Jim, am I missing anything here?
No, fleas, ticks, and this is how a lot of this, well, in some of the cases that I've dealt with, how a lot of this gets started with some clients. So they have like a homeowner will have a cat, or will have a guest that brings a cat into their house. May had fleas, may or not had fleas, but let's say if the cat did have fleas, and then the cat goes away with the guest, and the homeowner still thinks there's fleas in the house, right. Starts scratching their skin and stuff like that. So this is, and some of my clients that I've had, Faith, this is how it usually gets started with the fleas and the ticks and so on.
Yeah, so this is usually solvable, and it's usually pretty apparent, and entomologists can help you here. And entomologists can also probably help you with what we call obscure organisms. So the pests are present, but they're going to be hard to find. And bed bugs could fall in this category too. It could take hours of detective work. You have to be a knowledgeable diagnostician. So so this is actually a picture of bed bug bites on somebody's skin. And one of the examples that I like to use is no-see-ums, right? Because they're called no-see-ums for a reason. And people are like, I can't believe I'm getting bit. I don't know what is biting me. But there's clearly a cause. And if you look hard enough, or you understand the biology of the pest, you'll eventually find it. Another obscure organism here this time of year would be our urticating caterpillars. So the hairs can be problematic. I put this picture up here of this plus caterpillar because I just love the angle of this one. It's just way cool. But if you touch it and you didn't realize that you've brushed up against this kind of urticating caterpillar, it will leave marks on you, really painful ones.
And I think other examples of that, Faith, could be columbella. And that these springtails. Mm-hmm. So I remember back in the day with Dr. Kaler, they had gave some stats about some people who they thought had delusory parasitosis or egg bombs. I think it was out of 20, they had 20 people. 17 out of 20 people actually had columbella. Now, whether it caused that dermatitis or whatever is questionable, but something was there.
Mm. So that, and thrips are another one that we get occasionally, because they'll bite you and they're tiny and then they fly off,
Exactly.
So mites are also another one, and mites are even smaller than most of the insects that we're used to seeing, but they can cause a rash. So we have these, and this is some little, they're old names here, but we have grain mites and flower mites and cheese mites, and they can cause itching in people. And you can see here the hairs on this mite that would cause that kind of urticaria. So it's easily spread by other insects and human activity. And there's an awesome picture of grocer's itch, really. So these mites can be one of those obscure arthropod causes, and it's a cherodermatitis. And of course, if you're outdoors at all and you haven't had the experience of chiggers, poor you. Okay, so chiggers are really, they're tiny, and if you're not really careful about knocking them off of you before they are able to put their mouth parts into you, you're going to get a reaction, and you might not necessarily see the mites. So Jim, you spent a lot of time outdoors on those hikes, right?
Oh,
Ever
yes.
run into a patch?
Oh, yes. So we always tell people about chiggers and ticks. And so, growing up in Florida, you always hear chiggers burr on the skin, you put nail polish on it, right? So that's not the case. It's actually that their saliva actually causes that irritation. And so, and it is true. So if you come out from a hike or whatever and take a shower immediately, that'll help remove a lot of those chiggers and reduce that possible inflammation or whatever, the irritation that you have on your skin. We're good insect repellent is what you needed.
Yeah. So rat mites and bird mites are also causes of those obscure kinds of itches, and these rat mites can be really abundant during rodent eradication, or if you take a bird's nest out, you can have different bird mites. There are some economically important bird mites like northern fowl mite. Tropical fowl mite is another one, but these will also cause itching. And I'm getting down to the last couple of mites that could be obscure, that cause itching. That would be scabies. Oh my goodness. So Jim and I were just talking before this meeting. In all the years that I've been doing this, and this is a lesson to those of us who are in extension, we need to take all of these things seriously. I had a case where there was a woman who complained about having Norwegian worms, and I had not ever heard of this before. So I walked over to the medical entomologist, because we're right around the corner from the USDA, and he was our liaison, and he looked up Norwegian worms because he had an older textbook. And indeed, there were scabies, and the final outcome was that she did have scabies, and she had to go to see a doctor to get treatment for scabies. So scabies is a highly contagious skin infection. You get it by skin-to-skin contact. We see it in nursing homes. I haven't seen an outbreak in Florida in a while, but there's intense itching, and there's a pattern to scabies. These do burrow in that upper layer of the skin. So some people will say, oh, I'm feeling burrowing. And with scabies, you can actually see almost like a serpentine mine sometimes. And there's a picture as well of what scabies looks like on the screen. So, Jim, dogs, did you want to talk about dogs? And
well, I think it's the next slide with the
Demodex.
Yeah, the Demodex. And so this is one that this particular one right here only affects humans. Okay.
Yeah.
Now there is a mite that cause that demodetic mange that gets on dogs, and so that only is on dogs. But what it does is actually it's an irritant, so that dog will scratch and scratch and scratch, much like sarcoptic mange, but a little bit different, treated a little bit different. So, some people may see an animal scratching and scratching and scratching and think they have fleas or mites or whatever, and that leads to, thinking that they have insects or different arthropods. Now, one thing that, Faith, I wanted to show before we exit the mites, Julieta says, she wrote in our chat box, I've seen sticky tape pass through people's skin to show that bugs are attached. However, it was real. The lady had, in this case, the lady had bird mites that entered her room and she could see them. And it was true. She had bird mites biting her in her bedroom. Small mosquito species at dusk are very hard to see and they can bite in large numbers.
Absolutely. Yep, absolutely true. So thank you for that, Julieta. So the bird mites, we've had that's more common than we like to think, especially after a removal, right? Bird nest removal. The follicle mites, we all have them. There are 2 or 3 species on us. Sometimes they get a little bit out of control and they can cause this, it almost looks like rosacea, but it can cause a little bit of itching as well. But these are all definable and findable arthropod causes for itching. And finally, of course, we're going to have our dust mites. Highly allergenic, right? It feeds on the human skin, scales, pollen, animal dander, and we lose a lot of the skin, these skin cells every week. So this is also a cause of itching. So I'm going to move on real quick, Jim, to our illusions of parasitosis. This is probably the largest category, and it does cause a real dermal problem, but the cause is environmental and it's not organismal. And in these cases, it is not the job of an entomologist to treat or make recommendations for treatment because it's not a bug problem. So we mistakenly had this perceived by clients as being caused by bugs, but eczema, contact dermatitis, idiopathic urticaria, those are some of the reasons for the illusions of parasitosis. And that's the only slide I have on that, Jim. If we want to come back to the non-environmental causes later, we can.
Sure.
But here's the meat of our program today. It's going to be about the illusions of parasitosis. So if you've eliminated the 1, 2, 3 causes that we talked about, the 3 categories before, and you can't identify the cause, even after going through a very systematic process and looking at samples, we may be dealing with somebody who has a false belief that insects are infesting their body. And generally, these folks it's an unshakable belief that it's an insect. They're not open to other causes of itching. So this is known as delusory parasitosis, delusions of parasitosis, and of course, Ekbom syndrome. So we have about 25,000 people suffering from Ekboms at any given time. I would suspect at this point, the number might be a little bit higher, actually, of those who are suffering from Ekbom syndrome. It's characterized as a rare condition by the medical community, but pest control folks and entomologists see a lot of it. So we advise our PMPs, our pest control operators, to avoid getting involved in these cases, partly because there's nothing that they can do about it. And there needs to be some medical intervention at some point. Some folks may talk about Ekbom syndrome in the same way as they would do with Morgellons. And Morgellons is a little different. Folks who are suffering from Morgellons believe that fibers are emerging from their skin. The term has, it's been there for a long time, Morgellons, okay? So children with harsh hairs on their backs. And Ekbom syndrome and Morgellons can be psychologically contagious. So again, just like DP, families and work groups can share this condition. So I see from BJ here in the chat, Jim, did you want to look at that? Did you want to read that off for us from BJ?
So BJ has one. So my allergist says that when he gets these cases, he starts with a full medical workup and has found some correlation to liver issues. So try not to blow them off. So BJ, we're going to talk about some of the causes later on. So I'm glad that you brought that up because there are some real medical foundational causes as well.
And Juliet, a PMP is pest management professional. Sorry about that. So Ekbom syndrome, the sufferers are, we can have some who are very highly functioning. And Jim, did you want to talk about Travers a little bit, or?
Yeah, you know, Travers is a very interesting case. I mean, this is quite a few of the people. A lot of these people are highly educated. So this is a doctor, and I think Faith, she was a zoologist, right?
Yeah. Mm-hmm.
And so she thought she had insects burrowing in her skin. So this is kind of like a little case study that's very interesting to study. What's interesting with this, Faith, is that then you had it's called a term of madness between two. So she not only got it, but her family members started exhibiting it. Mm. And this is something that that happens in a lot of the cases that, you know, in some of the cases that I've dealt with. I'm sure some of our extension faculty share the same, where you can have the husband or wife think they have the invisible itches, and all of a sudden they get it too, and it could spread. But this went on for a very long time, and she actually felt vindicated because I think they found, what was it, dust mites or something like that, Faith. But it wasn't associated with that. But it's a really cool case study that you can read. And I'll send y'all the paper from Nancy Hinkle that explains about it. And really, with that 25,000 average 25,000, the latest, the 2011 paper, it has it more to 100,000. And the what she says on also, as far as there's probably 100,000, 200,000 cases that extension agents deal with every year.
I have no doubt about that.
No, that's probably underestimated.
Yeah, way underestimated. So ECBOMs. So again, many are high functioning and very intelligent, and we see a lot of that. I have some very educated folks talking about parasitology at a depth that is quite impressive, actually. And then something is just a clue that it's not right. ECBOM syndrome hits if you're less than 50 years old. The ratio of male to females is about 1-to-1. And once you go over 50, the ratio of males to females is, I think that's reversed. I'm so sorry. I think there are more females than males who suffer from ECBOMs.
Yeah.
The average clinical presentation is about 72. And so Nancy Hinkle in her first publication actually has a little bit of a profile there of those who tend to suffer from ECBOMs most seriously and most often. So the ECBOM behaviors, there's going to be picking and digging and self-mutilation, can result in severe blood loss and scarring, also bruising and traumatic hair loss because they're picking at themselves. Some of the common attributes include quitting their jobs, burning and destroying furniture, abandoning homes, obsessive laundry and dry cleaning, using pesticides dangerously and repeatedly. So this is a case that I got called into, and I've actually used this as an example of what a wettable powder looks like, because this person had treated their house to the extent that there were puddles of pesticide on the floor, splashed up on the walls, and at least the chair that she was resting in, she had self-treated with winding that was, even back then, not a labeled application. So, you know, this is, and this is done because they're desperate, right, to get a solution. So we have to be, again, very concerned for their well-being. Jim, anything else?
Yeah, you know, the using pesticides dangerously and repeatedly, not only pesticides, but cleaning products. So earlier on, BJ gave home remedies. So there you go. So BJ has a story. So a guy who came in mixed pesticide in petroleum jello, spread on his head, wrapped in plastic wrap and towel, and went to bed. His hair fell out, lots of scabs as the quote unquote parasites tried to get out. And so, yeah, that's a that's a normal story. And you have, I've been to some couple's house where they were spotless, and excessive, like you said, excessive laundry. They were doing that. Only happened in one part of the house, and they were actually treating themselves with bleach. They were pouring the bleach on themselves, on their skin, to get rid of whatever was itching with them.
Mm-hmm. So,
and provide skin scrapings, and you'll find that a lot of people who exhibit this are more than happy to give what they have. So either whether it's hair, lint, scabs, we've get it all. I've gotten bloody gauzes before, and people bring in jars of actual blood themselves, and that's something we don't deal with. You don't deal with that at all. But they're happy to bring that in, whether it's fabric softener from their laundry, anything. They're more than happy to bring in. But one thing that we try to show them is that there's no insects or no arthropods in that, and you could have that specimen on the microscope and show that individual that sample in the microscope where there's searching for legs, any insect parts, and they say, and I'll ask them, do you see any insects? They say no, but they're there in the same sentence. So it's a very difficult situation. It's kind of a sad situation too.
So we share these common attributes because if you know somebody who is suffering this way, they really do need some help. And it's probably, again, not an insect issue, but they're gonna eventually, this kind of pattern will lead to social isolation. They may have seen numerous physicians. They're going to reject help. That's the hard thing, is that they're rejecting the possibility of a psychological or other explanations, but they also express, you are my last hope. And it can lead to other family members also sharing that same delusion. So some of the descriptions, again, just to review: white and black, but changes colors. They jump or fly. They have 8 little legs and a small sucker, half moon cheese. I mean, we get a lot of different types of descriptions that don't comport with the typical insect or arthropod. About the size of a granule, long hairs that move independently, tiny white worms, lots of worms, because they think that things are like crawling in them. Infest inanimate objects, automobiles, furniture, clothing, and rug. So here's where, BJ, we get back to possible symptoms, which could be physiological. Sometimes this sensation of something burrowing in you could be an indication of brain tumor or other brain disease. And this is why we need to take these cases and treat them very seriously. It could be poorly managed diabetes or other endocrine and metabolic disorders. There were actually 5 cases of leprosy recorded at one point. Yeah. Drug abuse is more common than we know. And this skin picking because of cocaine bugs or meth mites is something that the pest control industry often sees. And it's a sad state of affairs. So other psychological symptoms, depression, anxiety, stress, schizophrenia, bipolar disorders. The origin of our organisms is attributed to a conspiracy. So that's how we know that we're dealing with something that's not maybe physiological, but psychological. And the psychological community is not in agreement over how to classify Ekbom syndrome or delusory parasitosis. So I've had it described as a simple phobia. Monosymptomatic hypochondrial psychosis is another way to say it. But people are otherwise functional, and there's not necessarily a specific course of treatment. So did you have anything else that you wanted to jump in here on, Jim?
No, I wanted to share a couple other things from our faculty. And this is relating to the previous one really quick. And Julie McConnell up there in North Florida. And so she says, lining home with visqueen and releasing lizards to eat the mites. I've never heard that one before. And Ava Buckner, who, and she says, this is basically the hardest part of my job. And I totally agree.
Yep.
It's extremely difficult. And, you know, one of the things I was telling Faith earlier is that, you know, one of the things that stuck with my medical and veterinary entomology class back in the day with Dr. Kaler is that when he was talking about delusory parasitosis versus the real problem, and he says, you know, you can never prove a negative. So it's possible to prove something is causing the problem. It's not possible to prove that the problem is in the mind. And so this is something that, you know, you have to really look at it that way when dealing with these individuals. And, you know, they'll come up to you, Faith, and they'll say, you're my last hope, right? You're my last hope. I've seen, you know, I've been here, I've been there. Can you identify something? Can you write something down on paper and so on? And it's that unshakable belief that something is there. And it is almost, from my experience, and, you know, our faculty can chime in on this, it is extremely hard to change the mind. And sometimes they will actually, they'll leave, or the homeowner will flip and be kind of mad at you for not solving the problem. But one of the things that, and they are, Julie, you're exactly right. They're desperate for solutions. It's a very stressful situation in this time.
Absolutely. And there's evidence that psychotherapy can help, but you have to have somebody who's willing to undergo it. And so the mean duration, according to Hinkle, of DP is about 3 years. And the variance is quite wide. It's plus or minus 4.6 years. There's a 50% chance of remission. And that's an interesting term to use, right? Remission. It doesn't mean cure. It becomes more difficult to treat with time. So another, a new phenomenon for us is the advent of social media. And so there are, you know, they're able to share what I have not, I don't know how else to put it except that it's a psychotic disorder sometimes via the internet. And they'll compare symptoms, self-diagnose, and this is quite dangerous, especially if there is an underlying physiological concern, and self-treat. There's a lot of misinformation on the internet, as we all know. And sufferers complain that doctors and entomologists are callous, incompetent, ignorant of parasitic infections. And again, for us as entomologists, in the absence of the arthropod, there's not anything that we can really do. So sufferers complain that doctors, again, are not competent, and there are some neuropharmacological drugs that can treat, but you have to be willing to accept that there's treatment that is needed. So here's the course of action. we have to determine first that arthropods are involved, and we have awesome Lyle bus to help us. And again, it may be one of those illusory parasitosis things, right? Something that is for real, but very hard to diagnose. And Lyle has the patience of a saint, and he's really excellent at helping us diagnose these issues. If there are no arthropods, we will, refer you to a doctor or a dermatologist, because the physicians first have to rule out that there's a physical disorder, and we may need to have some kind of psychological or psychiatric support here. Again, we never recommend treating homes without the evidence of pests. And I actually called in our good friend Nancy Hinkle I call it up the street at the University of Georgia, where her lab has a lot of experience in this. The student who's working with her in trying to solve these issues is Emily, and I have her phone number and an email there. And she's willing to work with clients and friends and family who may need support and help. And she has the resources to do so. So we're gonna start, kind of start winding down here, but I wanted to share with you some, again, of the attributes of DP sufferers. There's a lot of data that has gone behind these tables. So again, it's going to be most common in older people, disproportionately female, exhibits behaviors such as quitting their jobs, burning or destroying furniture, abandoning homes, obsessive laundering and dry cleaning, use of pesticides dangerously and repeatedly, use of home remedies, mutilating bodies in an attempt to remove the offending vermin. So, Jim, I'm gonna, did you have anything that you wanted to share at this point here?
So Melissa said, I had a friend that suffered with this for about 4 years. Was not sure how to help her. Eventually it just went away. Almost everything you discussed, she experienced.
Wow.
So that's about right. And if our attendees have any questions, you can go ahead and type in the Q&A. For our panelists, once our attendees exit, I'm going to open the mic for y'all. I've promoted the people that I know that were agents, that were attendees. Now you're panelists. So we'll do that at the end. But, one of the things that you really, to me, is extension faculty and is, for master gardeners and stuff like that, how to deal with this is, first of all, this is my suggestion. It should go to the agent. It really, with my master gardeners, I really didn't have them deal with any of this. They weren't trained to do it, even though we have healthcare professionals working as master gardeners. That's not their position. Some great advice, and I think this is also in one of Nancy's publications, but David Holmes, he's retired CED in Marion County. We were talking about this at one time, Faith, and he said his experience dealing. We know David's been around, he was around for a long time. And he would always end up, with these individuals, taking the sample and say, good news, there's no insects, there's no arthropods in your sample. That's really good news for you. So, and then, he would probably suggest going to a healthcare professional at that time. But he would always end up he would always end it on a positive note, like, oh, this is really good news. You don't have any insects that's in your sample. So, and that usually satisfied them, not always.
So I'm trying to get this to that here. Okay, there we go. So other common attributes include skin scrapings, can provide extensive, elaborate, involved descriptions of pests, their life cycles, and their behaviors. So we have, I have a file of how these descriptions go from credible to the incredible. And there was one that was several pages long. So I think that Travers' publication, Jim, was like 22 pages, right? She wrote up about 22 pages, very involved in description. But there was one that I remember came in that he had parasitology background. And so it was all very credible until the end where he named his pest Oscar. And that's how I knew that something was not right. But you have to kind of be very patient and very, very careful about trying to read through what is credible and what is not. And sometimes it's a very lengthy process because people are desperate to find a solution. So they do a lot of research, right? And then there are lots of credible pieces until something just strikes you and goes, So that elaborate description part can be a clue. We are really concerned about that social isolation aspect. Abandoned family, to avoid infesting them. There's emotional trauma. And again, have seen numerous physicians to no avail because there's really not a lot of training for physicians in this area, if at all. So, Jim, anything else to add on this one?
Mindy says, well, Mindy wrote, I have read that things like this issue can be adjacent to obsessive compulsive disorder. Not sure whether OCD medications have been tried in an attempt to manage illusionary parasitosis.
Yeah, I don't have enough information on that, Mindy, but that's a really good, point. We can look that up. So again, the mean duration of the delusion. We've talked about these before, about the complaints of itching, crawling, pinprick sensations, and rejecting the possibility of a psychological or other explanation, and the expressed desperation of "you are my last hope." And that is so very sad because we are really not able to help them. And so I actually called Dr. Hinkle before this presentation, and we were still lamenting the fact that we really don't have a lot of good solutions for folks who are suffering, truly suffering from DP, because it is not an arthropod issue. It's almost as if there's a gap between what a physician can do and what an entomologist can do to help solve these people's problems. So there is no such thing as a paper mite. If somebody is telling you that you have a paper mite, you don't have to have any control. And I put this in here because we're running into the winter months right now, and we get an uptick in the winter months of people claiming that they have paper mites. And part of it is because we're inside a little bit more, the air is going to be drier, even in Florida. And so there are other, reasons that can explain sensations on the skin. I don't use this example anymore, but women used to wear nylons at one point, and that used to be a really common thing, that the nylons are causing static electricity, but people's dress has changed as well. So just be aware, if you have friends and family, as the air dries out, if they have sensation on their skin but no identifiable cause, it could be something that's more on the not direct cause, not insect. So do you have any other questions or comments here? That was the last slide that I have. And let me see if I can get here to, if you all don't mind doing this last poll for us, I'm going to launch this poll here. And if our panel if you would like to answer, that would be fantastic as well. So can y'all see that? There we go. So Jim, can you see that on your side?
Yes, I'm good. My internet just kicked out.
I saw your message come through.
I was like, So I don't know if what y'all heard, but one of the things I wanted to share was, I attended your pest management university, and I was speaking to one of the pest management professionals, and it was I think we were talking about delusionary parasitosis at one time, and And this is a gentleman from up by there in the Panhandle, I think. And he said he was had this lady who had, a case of delusory parasitosis. So she was asking him, come back, you got to spray more. Come back, you got to spray more. And of course, he's saying, I cannot do that. But as a good pest management professional, he went there and he tried to help her. He tried to solve the problem. And so he noticed the chair where it was located in the room, and it was directly under the air vent. And it was the insulation coming down through the air vent, getting on the lady, very sensitive skin, and started to scratch, thinking that she had the invisible itches. And so that problem got solved through good detective work.